Breast awareness. Breast awareness enables you to become familiar with how your breasts usually look and feel. Once aware about what is normal for you, it is easier to detect any new breast changes. Breast self-examination is a systematic way to help you learn how to examine your breasts. It is easy to learn and takes only a few minutes to perform. While breast self-examination is important, research indicates that when used on its own, breast self-examination may not accurately detect breast cancer. Because of this, breast self-examination must be used in addition to, rather than as a substitute for, clinical breast examination by your healthcare provider. Your healthcare provider may also recommend a specialized breast cancer screening test, such as a mammography. Remember, every woman is unique, and individual consultation with a healthcare provider is important to assess your own risk level for breast diseases such as cancer. Your healthcare provider can then give you specific recommendations according to your age and risk profile. Self-breast examination. Look, feel. It's important to know your breasts. Regular breast self-examination will help you know how your breasts usually look and feel. Once aware about what is normal for you, it is easier to detect new breast changes. It's important to note that not all breast changes are due to cancer. Your healthcare provider must assess and give professional recommendations for any breast changes you see. When to examine. Women can begin practicing breast self-examination from when they are about 20 years old and continue the practice throughout their lives, even during pregnancy and after menopause. Breast self-examination can be performed every month. To schedule your self-breast examination, use the following general guide. If you still menstruate, the best time to do a breast self-examination is 7 to 10 days after your monthly period begins. Your breasts are less likely to be tender or swollen at this time. If you no longer menstruate, pick a day, such as the first day of each month, to remind yourself to do a breast self-examination. If you are taking hormones, talk with your healthcare provider about when to do a breast self-examination. How to conduct a breast self-examination. Breast self-examination is easy. It's simply look and feel. The following simple steps will help you examine your breasts in a systematic manner. Confirm that you have correctly learned the technique during your next visit with your healthcare provider. Look at your breasts. First, make sure you are in a room that has good lighting. A big mirror will help you detect any changes in the look of your breasts. Then follow these simple steps to examine your breasts. You can look at your breasts in a standing or sitting position. While standing, place your hands on your hips and press firmly down on your hips. Pressing your hands down on the hips contracts the chest wall muscles and enhances any breast changes. Now look closely at your breasts. Then turn side to side. Look again. Are there any changes in breast size, breast shape, or breast contour? Now look closely at the skin over your breast. Are there any skin areas that have a change in color, are scaly or dimpled? Note that dimpled skin looks like an orange peel. Now look closely at the nipple. Is there any change in the shape of the nipple? Is the nipple drawing inward? Has the direction that the nipple is facing changed since your last examination? Is there any change in the color or texture of the nipple skin? The next step is to lift both arms up and place your hands at the back of your head. Now gently turn side to side. Look at your breasts again, including the nipple area. Are there any new breast changes since your last examination? With your arms still lifted above your head, lean slightly forward, then look again at the shape of each breast, including the nipple area. Are there any changes since your last examination? Once you have completed the visual breast examination, note and report to your healthcare provider any changes that you have observed. Feel your breasts. Position posture. Breast palpation is easier and more effective while you are lying down. This is because the breast tissue spreads evenly over the chest wall and is as thin as possible when you lie down. This makes it much easier to feel the whole of your breast. You will need to lie flat on your back. If you decide to examine your right breast first, put a pillow or roll towel under your right shoulder. Then, raise your right arm and place your right hand behind your head. Now use your left hand to feel your right breast. Once you have completed feeling the right breast, change the position posture to the opposite side. Now you can examine the left breast. 2. Where to palpate. The breast should be palpated over the entire area that is within an imaginary line that extends down from the middle of the armpit to just beneath the breast and continues on across the underside of the breast to the middle of the chest and then moves up the collarbone back to the middle of the armpit. 3. Palpation technique. Use the pad of your first 3 fingers to palpate your breast as indicated here. Your hand should be placed horizontally over the skin of your breast in a parallel manner, like this. Do not poke. Then, move your fingers in small coin-sized circular motions over the breast area, like this. Do not lift your fingers from your breast between palpations. Always begin with light finger pressure to feel the top layer of the breast. Then, increase to medium pressure to feel the deeper breast tissue layer. And finally, use firm pressure to feel the deeper breast tissue that is close to the chest wall. Feel for any new breast changes such as lumps, hard knots, and any thickening or swelling. 4. Palpation pattern. You can use any of the following 3 patterns to ensure that you palpate the entire breast area. Each of these patterns should end with palpation of the nipple area. The vertical line pattern. Palpate the breast in an up and down pattern starting at an imaginary line drawn straight down your side from the armpit to just below the border of your breast. Then, move a finger's width inward and towards the middle, and continue palpating in an upward direction until you reach the collarbone. Continue with this up and down pattern until you have covered the whole breast area. You may need between 10 and 16 strokes to cover all of your breast tissue. Once you have palpated the whole breast area, examine the opposite breast using the same palpation pattern and technique. The circular pattern. Beginning at the outer edge of your breast, move your fingers around the outer breast area in a circular pattern. Once palpation along this circle is complete, move the fingers along a slightly inner circle. Repeat this pattern until the palpation circle gets to the nipple area. Once you have palpated the whole breast area, examine the opposite breast using the same palpation pattern and technique. The pie wedge pattern. Mentally divide your breast into small wedge-shaped portions. Palpate each wedge portion by moving systematically either clockwise or anti-clockwise from the starting point. Remember to palpate the armpit and upper chest area. Once you have palpated the whole breast area, examine the opposite breast using the same palpation pattern and technique. 5. How to examine the armpit. Examine the armpit this way. 6. How to examine the nipple. Squeeze each breast nipple gently. Is there any tenderness or pain? Is there any discharge? Many women have a normal discharge. Nipple discharge can also be a sign of a breast problem. Also note any discharge in your bra or clothing.